I'm here at Nashua High School South. I want to give you an update on the status of the city's coronavirus response. As I've said before, this is a big, huge community effort. I want to thank everyone who's involved. It's really brought forth the best in many, many people. We want to thank, of course, all of our public health nurses and public health staff. Also the people, the medical workers who work in the hospitals, our nurses, our doctors, but everyone else as well that is assembling this entire response. Our teachers for doing all the remote learning, even people who work in the grocery stores who are making sure we have enough to eat, and of course are exposed to a lot of people in the public. Right now, we have, as of last night, we have 28 cases, positive cases of coronavirus in Nashua. But there are a number of other tests that are pending, so we know that number is going to rise. There are several people, there are a number of people hospitalized, and also, unfortunately, 2 people here in Nashua have passed away. But we are working hard to enforce what we call the social distancing, in other words, physical distancing of people. As I'm sure you know now, City Hall has been closed for nearly a couple of weeks to the public, and all city workers are working remotely except for essential employees such as police, fire, public works, picking up the garbage, things like that. In any event, right here at Nashua South, some of the volunteers, and we have many volunteers across the city that are working very hard, some of the volunteers that are working hard are the so-called CERT volunteers. So what we have is a community CERT stands for Community Emergency Response Team. These volunteers help to unload supplies here at the Alternative Recovery Center. Here at Nashua South, what we have is we're setting up excess capacity in the event that our 2 hospitals, Southern New Hampshire and St. Joe's, don't have the hospital capacity to handle what we call the surge, the peak in coronavirus cases. So this will be an alternate site where people who are less ill, possibly even without illnesses other than coronavirus, can recover. People who don't need all that intensive care that the people in the hospital need. So that's what we're doing here at Nashua High School South. But there's clear scientific proof that everything we're doing here in Nashua and things that are being done around the country to keep the social distancing, to keep people apart, the closing of City Hall, of the schools, and particularly the restaurants and the bars, all the public places, is having an effect. When the temperatures of hundreds of thousands of people are measured across the country, and this is being done has been done for several years now in order to predict flu epidemics, when those temperatures, hundreds of thousands of people every day are logged in and they take their temperatures, what it shows is it can predict where, as people's average temperatures rise, it can predict where flu is going to break out, and now where where several days down the road or a week down the road where coronavirus is likely to break out. And these national temperature surveys show that in places like Nashua, where we have done the social distancing, where we've closed the bars and restaurants, where school is closed, average temperatures are declining. This means that this is proof that we're having an effect. Now, certainly people in the city, Nashua and around New Hampshire, are going to continue to get the coronavirus, but the point here is to limit the number of cases, limit the spread, reduce the number of people who contract the virus, reduce especially the number of people who die or pass away as a result of contracting the virus. Some people, out in the media across the country have said, well, why don't we just let it rip, and the people who will die are the ones that are likely to die anyway. That's nothing that we agree with here in Nashua. Every life is sacred. We're working to save every single person we can, regardless of age or anything else. And by working together, we are going to save lives, and we are saving lives. Thank you to all of these volunteers. Thank you to all of our healthcare workers, everybody in the community who's working on keeping apart from others. Because of course we know that there are people who can contract the virus who don't have symptoms and can carry the disease. So we'll be giving you an update again in a couple of days. But let me reassure you that city people are working 7 days a week to try to keep our city, every one of our citizens, as safe as we possibly can. Thank you very much, and God bless.